I'm Rob Rosenthal for AskTheLawyers.com, and this is Ask the Lawyers. Prostate cancer is the second most prevalent cancer for men in the U.S., just behind skin cancer. One estimate is that 1 in 7 males will be diagnosed with prostate cancer in their lifetime. Now, luckily, it is very treatable if caught in its early stages. Back in the early 1990s, prostate-specific antigen, or PSA, blood tests were highly valuable tests for screening for prostate cancer in its early stages and were routinely administered to men over the age of 50. One notable statistic was that mortality for prostate cancer was thereafter reduced by 40%. However, beginning in 2012, and because of a highly questionable and criticized assessment by the U.S. Preventative Task Force about overtreatment, many doctors began discontinuing PSA testing without discussing the issue with their patients. This led to many cases of undetected prostate cancer at its early and very treatable stages, and many times tragic results when the cancer was allowed to spread beyond the prostate without detection and treatment. Attorney Frank Cristiano of Cristiano Law in Denver, a medical malpractice expert who himself has had an experience with prostate cancer detected by PSA testing in its early stages, says doctors who discontinued routine PSA testing for men over 50 without conferring first with their patients are, in his opinion, not abiding by reasonable practice standards. Attorney Cristiano recommends that men over 50 make a point of assuring that their doctors order the test, especially if their medical or family history puts them at a greater risk for prostate cancer. Cristiano also says if you think you or a loved one have been the victim of medical malpractice, and more specifically as it relates to prostate cancer and the delay of timely diagnosis and treatment of such, you should contact a lawyer with experience in this area to assess your legal rights. Get started at AskTheLawyers.com.